My name is Chelsea, and I'm a Neural Resource Facilitator at the Brain Injury Alliance. And I just want to give Tazia an introduction before she gets started for us today. So, Tazia is currently a rising fourth-year medical student pursuing a dual MD and PH at the University of Iowa College of Medicine and is currently interning with the Brain Injury Alliance. She hopes to pursue psychiatry as her specialty upon graduation. She has served as the Brain Injury Support Group facilitator in Iowa City for 3 years and was first exposed to the brain injury field as a brain injury specialist at Community Neural Rehab of Iowa, where she worked for 2 years. She hopes to utilize her training to educate healthcare providers on how to better serve the brain injury community as a future physician.
All right. Well, hi, everyone. And thank you, Chelsea, for the introduction. And thank you all for being here. It's really nice to see you all. But I wanted to just briefly preface this presentation by saying that I am by no means an expert. I'm a student learning about brain injury and how to better serve and empower individuals with brain injuries, which is something that I'm really passionate about. And it's something that I'm very much still in the process of learning about myself. I know that some of you have probably been in the field or been exposed to brain injury for much longer than I have, but I hope that through the information that I've put together here, that you all can gain at least one tidbit of information that will benefit you or someone else. So yeah, I just have some disclosure statements there. Okay, so we have a couple of objectives for the presentation today. The first one being understanding what advocacy and more specifically what self-advocacy is. And then the second objective is understanding why self-advocacy is pertinent to brain injury survivors and caregivers and why it's important to practice. And then the third objective is learning about what steps you can take to become a better self-advocate, or what steps you can take to help a person with a brain injury become a better self-advocate. So if you're told to be an advocate for yourself, or if you're advocating on the behalf of someone else, what does that actually mean? So advocacy is the act or process of supporting or recommending a specific cause that pertains to another, oneself, or both. So basically it means pleading your cause or case, whether that's telling your provider or a friend or family or your boss what it is that you need, or doing so on someone else's behalf. So it's really important to understand that there are different types of advocacy. So for this presentation, I'm primarily going to be focusing on self-advocacy. And so self-advocacy is when a person advocates for their own interests. Everyone self-advocates at some point in their lives, whether that is to a healthcare provider, to your boss, to an insurance company, to your friends and family. It's basically supporting yourself and saying that my proposal is that I receive X, Y, or Z, and this is why I want to achieve that outcome. And then there's individual advocacy, which is when a person focuses, or a person or a group focuses on the interests of one or a few individuals. So for an example, a caregiver or professional advocating on the behalf of a survivor, say at a doctor's appointment or in whatever setting, is an example of individual advocacy, and that may apply to some of you. So while self-advocacy and individual advocacy focus on the needs of one or a few people, systems advocacy is more on a broader level. So it seeks to change things that are on a local, state, or national level through laws or policies. And because it focuses on changing systems for the long term, this kind of advocacy can be very complex and can involve large groups of people working together to raise awareness and pressure legislators. So for example, rallying on the Hill in Des Moines during the BIA Hill Day, for those of you who are familiar with that, and fighting for the rights of individuals with brain injuries is an example of systems advocacy. So I think it's important to kind of understand the history of self-advocacy. So the self-advocacy movement started in the 1960s in Sweden with a group of individuals of both people with and without brain injuries. And it was later identified that individuals with disabilities have their own unique needs. So in the 1970s, there was an event called the First Convention for Mentally Handicapped, which is what it was referred to at the time, which started in British Columbia. And at the time, there was still this narrative that people with disabilities should be identified on the basis of their disability. And there was actually a gentleman at the convention who identified this, and he got that this was wrong. And he got up and said, "I want to be known as a person first." And this kickstarted the person first movement, which I actually don't have on the slide. And that was started in the same year. And this was kind of in the honor of his efforts and also to highlight and spread awareness of the kind of language that puts a person before their diagnosis. And they then organized their own convention called the People Person First Convention, I believe. And this is the purpose of this was basically to give people with disabilities a space to speak for themselves and to share ideas, form friendships, and learn new information. And then in the 1990s, the ADA, or the American Disabilities Act, was signed. And I'm sure a lot of you are aware of this, but if not, it's extremely important because it was the first bill signed that gives civil rights protection to individuals with disabilities and ensures that they have the same rights and opportunities as others. And then in the 2000s today, there are hundreds of self-advocacy groups around the nation, and specifically the organization Self Advocates Becoming Empowered have hundreds of chapters nationwide, and there's actually 2 chapters in Ames, I believe, and they have more information on their website about that. Okay, so this is kind of a conceptual framework that captures the most important components of being a self-advocate, and they all kind of interconnect. It was developed through like a meta-analysis or a large-scale study that was done on individuals with disabilities. So the first component is knowledge of oneself or self-awareness. And it's basically being aware of one's own strengths and weaknesses as an individual with a disability, or an individual without a disability for that matter. So, for example, you may struggle to speak up for yourself verbally, but you may be good at expressing your thoughts in writing, for example. And this is something that's really important to be aware of about yourself. And then another component of self-advocacy is knowledge of rights. So this is awareness of relevant federal laws and policies that pertain to you. So for example, if you have a brain injury or any disability, being aware of the ADA or the American Disabilities Act is really important. And then you have communication, which basically entails behaviors that ensure that you are expressing what you need. So an example of a successful, or I guess, a good form of communication involves engaging in assertive but not aggressive communication with others when expressing your needs. And that's something I'll get into a little bit later. And then finally, leadership. And this basically encompasses awareness of your individual rights, roles, and responsibilities in the context of the group that you're a part of, and being a part of large-scale like advocacy efforts with this group. So this would be more along the lines of systems advocacy, which we described earlier. Okay, so self-advocacy is hard. And I do want to acknowledge that everything I'm going to be talking about later is much easier said than done, and it takes a lot of work and patience and practice, whether you have a brain injury or not. It's not easy to express your needs and wishes, and this is especially true for individuals with brain injuries or any sort of disability. So I want everyone to understand that it's okay if this is something that, takes a lot of work. And I thought I would kind of highlight this with a few statistics. So there was a survey that was done by the National Council of Disability that found that only 29% of adults with disabilities felt that they had the skills to advocate for themselves. And then there was another study done on adults with chronic and life-threatening illnesses, which is a little bit different, but kind of in a similar category. And they found that 61% of them felt that they lacked the skills to advocate for themselves to their provider. So if you are a survivor or caregiver or professional and you feel that advocating for yourself or on the behalf of a person with a brain injury is difficult, then you probably aren't alone. Okay, so as we all know, practicing self-advocacy is easier said than done, especially for a person with a brain injury. And it's extremely important to acknowledge some of the limitations that there may be in a person with a brain injury in advocating for themselves. And there's certain aspects of self-advocacy that some of the impairments that can be caused by brain injury might make much more challenging. And it's important to acknowledge these. So this isn't an exhaustive list, but some examples include speech and language impairments, which would make it more difficult for someone to verbally express their needs and to formulate or articulate their thoughts. Personality and behavior changes. This makes it difficult for the person to maybe carry themselves in a way that unfortunately might be perceived negatively by the other party, because sadly there are a lot of people out there who are quick to judge and don't have very much patience for these people, and they can't see that this behavior is as a result of the injury and it doesn't define that person or who they are. And then delayed thinking and comprehension. This can make it difficult to process what the other person is saying during a conversation. And then you have cognitive deficits such as impaired concentration and memory. And these things can impede, one's ability to carry on a conversation. It can hinder their ability to identify what their needs are and to effectively communicate and bargain those needs in an assertive manner. And then finally, emotional challenges. A person with a brain injury might face challenges regulating their emotions as a result of some of the symptoms of their brain injury that can cause difficulties with recognition and expression of emotions. And the process of advocating itself can trigger some of these negative emotions, because there may be a lot of moments of frustration and anger if they don't feel like they're being seen or heard by the person they're advocating to, which can lead to a breakdown in communication. So these things are really important to acknowledge when kind of determining what the self-advocate's personal boundaries are. Yeah. So it's really important to recognize that one of the major, I guess, barriers to the effectiveness and practice of self-advocacy is ableism, which is the discrimination of and social prejudice against people with disabilities based on the belief that able-bodied individuals are superior, which sadly, that is integrated into the fabric of our society, and it's a bias that a lot of people still have. And it's also one that even professionals and caregivers aren't immune to. So it's important for the self-advocate with brain injury or a professional or caregiver or whoever it may be advocating on their behalf to be aware of what it looks like, because they may encounter this during their advocacy journey. So just kind of a quick overview of what this might look like. Ableism can come in both overt and covert forms, like overt being more outward and obvious forms, which isn't as common, but is still out there, and covert forms, which professionals and caregivers and people who are very well-intentioned can be prone to. So some examples of this, overt forms of ableism include lack of compliance with disabilities laws like the ADA, segregating adults and children with disabilities in institutions, buildings without like signs in Braille, refusing to provide reasonable accommodations, things like that. And covert or less obvious forms can include framing a disability as either tragic or inspirational in news stories or movies, which isn't always a bad thing, but it can be done in a very distasteful way. And then also talking to a person with a disability like they're a child, or talking about them instead of directly to them. And then this one is very relevant to a lot of people with brain injuries, and which is assuming that people have to have a visible disability to actually be disabled. And then also using certain verbiage like, saying that, oh, she's a psycho, or, oh, you don't even look disabled, which again, it might not come from having bad intentions, but it still kind of propagates this idea that, having or people with disabilities are inferior. Okay, so why is it important to self-advocate? Um, in general, it improves outcomes. It helps the other person the survivor is advocating to understand the specific needs of the survivor, and also it can support the process of other people understanding the unique needs of individuals with brain injuries or other disabilities. It can help the survivor increase their interactions with the other person, and it provides more opportunity for them to thoroughly explain their side. It can potentially increase the understanding of the person with the brain injury of their own needs. And all of this kind of comes together to help decrease the anxiety that comes with not having your needs met. And also, the process of being a self-advocate can demonstrate your commitment to taking ownership of your own well-being and being a part of the process. Okay, so the dignity of risk. So this is a concept that every person, including people with brain injuries and other disabilities, have. It's basically the idea that they have the right to make an informed choice to engage in experiences meaningful to them, which is necessary for personal growth and development, even if there is a small risk associated with it. Being a self-advocate or speaking up can be an example of this. Or even just life decisions like pursuing a relationship or traveling to a new place. All of these things have some risk associated with it. And this process can often be limited by very well-meaning individuals, such as caregivers or loved ones or professionals, or even survivors themselves if they're afraid of taking a risk. But it's important to find a way to balance acceptable risk and protecting one's safety with promoting their personal liberties. And when we allow room for some risk and allow the survivor to maximize their strengths, this can really increase their self-confidence, and in turn their ability to their belief in their ability to successfully advocate for themselves and achieve their goals. So when is it acceptable to be a self-advocate? Anytime you need something, whether that's at home with family, with friends, at the doctor's office, your boss, your insurance company, self-advocacy is not limited to certain situations. Okay, so this is where we get to the good stuff. Before starting the process of self-advocacy, it's important to determine what issues are most important to you. Are you looking to ask your boss for a raise? Are you asking your professor for more time to complete an assignment? Are you letting a friend know that you don't appreciate the way that they're treating you? Are you asking your doctor to change your medication? Regardless of what it is, the first step is to identify what it is that you need. So this just kind of summarizes the steps that one can take in order to become an effective advocate. The second one on the list, I already kind of went over. The first one here, educating yourself about your condition, is also really important. And it's essentially understanding your brain injury and what challenges you may face as a result of it. Along with this, it's also really important to be realistic about the impairments you may have as a result of your brain injury, and what personal boundaries and limitations that may cause. And one point that I want to emphasize is that it's okay if one of these steps is beyond the scope of your personal abilities or what you're comfortable with. One size does not fit all, and there's really no right way to advocate. It really depends on what feels right for you. Okay, so moving on. So the next step is breaking down the problem into smaller pieces. So oftentimes what seems to be one big problem involves a lot of smaller problems. So in order to ensure that the process doesn't become overwhelming, breaking your problem down into smaller ones can really ensure that you have more insight into what steps to take. And you might find that parts of the problem are easier or more feasible to solve, or that you have more control over them than others. So I'll try to demonstrate this with an example here. So suppose the survivor has a job and has been arriving late to work because they have difficulty waking up early due to a medication that they're taking. Their boss told them that if they can't arrive on time, then they can no longer work there. The survivor has expressed to the doctor to change their medications, but the doctor is unwilling to do so. So in this example, the problem is broken down into 4 smaller problems. The first one being the survivor is sleepy because of medications. The survivor is arriving late to work. Survivor's boss has threatened to let them go if they don't arrive on time. And then the survivor's doctor will not change their medication. So in this example, you might find that you can solve the problem of arriving late to work by transferring to a job that starts later in the day. On the other hand, you might find it easier to work on being a better self-advocate so that your doctor changes your medications, which, sometimes even if you are a really great self-advocate, that might not end up happening because, for example, the doctor might have reasons for not prescribing you with the medication, like, interactions or side effects or other clinical guidelines that they're following. But in general, you can save yourself a lot of time and effort and also make the process of problem solving more manageable by identifying from the get-go which parts of the problem are most important and worth your time to address. Okay, so identifying preliminary steps. So when you speak up for yourself, you need to have a strong sense of what you're talking about or communicating about, which requires gathering facts. And there's a lot of ways to do this and to get accurate information. You can do this by talking to someone who's had a similar experience as you or has been in a similar position. You can talk to someone with special expertise in that area. So for example, if you aren't receiving accommodations at school, you can talk to your university's disability office or student support program. If you're discriminated at work, against at work, you can talk to your local civil rights commission. If you aren't receiving adequate care with your medical provider, you can visit your hospital's Office of Patient Experiences. You can also use the internet or talk to a librarian at your local public library to get more information on reliable sources. And then you can also reach out directly to organizations or agencies that specialize in disability services. And this is this can be a really difficult and overwhelming process. And so here it's really important to have a friend or loved one or a professional that you work with for support. And then once you've identified the issue and gathered information, it's really important to ask yourself and write down answers to the following questions. What are the possible outcomes of the problem that you're trying to solve, regardless of whether it's ideal or not? What alternative outcomes do you find acceptable to you, even if it's not, what you originally planned for? What might be some barriers to achieving what you want, whether that's on your side or on the other side? So by asking yourself these questions, you allow yourself to be mentally prepared and understand what's realistic, which can really help you determine your course of action. Building your case. So this is all about understanding both ends of the issue. Identify what makes your case strong. Have you been denied reasonable accommodations at school or work? Do you feel mistreated by a family member? Do you have clear symptoms of a condition that the doctor won't prescribe you medications for? What is it that makes your case convincing? And it's also really important to look at the other side. So why is it that the other side is acting the way that they are? What might they benefit or what might they lose by supporting you and your case? Is there a rule or a policy that they're following? For example, if you really feel like you need an opioid prescription because you've been having severe pain, but the doctor isn't prescribing you that medication, it might be because they're obligated to follow medical guidelines and best practice, for example. Um, and, that's not to say that your concerns aren't valid, because they absolutely are, but it is important to acknowledge the other side's viewpoints as you advocate for yourself, because it can really show that you appreciate their perspective. And this can also really help maintain your relationship with them and also really keep things in perspective. And then it's also important to gather necessary documents that can provide evidence of your case. So, for example, documents concerning healthcare, insurance benefits, letters of support from doctors or therapists, photocopies of laws and regulations, insurance policies, pay stubs, whatever it is that's relevant to your case. So deciding on an action plan. So now that you know what you want and you've gathered the information and you've thought about the points you want to convey, what is the best strategy for getting what you want? The first step is to make sure, and I'll keep reiterating this, ask for support, whether that's from family, friends, healthcare providers, an advocacy organization. Maybe it's people that you've met in the brain injury community, like through a support group. Just find people who are in your corner and who will help you build your foundation. And once you have support, it's important to target your efforts and identify who it is that you need to talk to that can best assist you. So, for example, if you experience patient mistreatment, you might need to talk to your hospital's Office of Patient Experiences, which is an example that I provided earlier, to discuss your care. You can look up information about the office that you want to contact on Google and find the appropriate person to call. Or if you can't find the name of a specific person, don't be afraid to call the number on their homepage or contacts page on their website and ask who to talk to. And one helpful hint here is, when contacting someone from an office or agency, it's often best not to start highest up on the ladder, or to talk to the big boss, but to start lower on the totem pole and work your way up to the highest authority if needed. And then it's also really important to identify the best method of communication, or in other words, how are you going to deliver your message, whether that's through verbal communication with in person, or via video conference, or on the phone, or whether that's through writing a letter. And this is really going to be determined by kind of your own abilities and what you're comfortable with. And then it's also really, really important to set goals for yourself. And a good way to do this is to follow the acronym START, which, or sorry, not START, SMART. And this stands for small and specific, setting small and specific goals, setting goals that are measurable or that you can track your progress in, setting goals that are achievable or feasible to accomplish, setting goals that are relevant to you and what you need and that are also reasonable, and then also setting goals that are time bound or that are possible to accomplish in a reasonable amount of time, or a time frame that you set for yourself. Okay, so record keeping and note taking. So self-advocacy requires that you tell your story over and over again sometimes, and it may be easy in this process to gloss over some of the details if you wing it, so to speak. So writing your story is a great way to be clear about the details and order of events that you want to communicate. This can save you a lot of time and effort and help you in communicating the details consistently, whether you communicate it verbally, whether you have, someone else communicate it for you, or even if you have copies of your story typed up or written up that you hand to the other person as a summary. One helpful tip is to have a binder with dividers and plastic sleeves to kind of organize all of your papers arranged by subject, date, and type of document. It can also be helpful to keep a paper trail during a conversation that you're having with someone. So it's really important to have a record of events and decisions that are important to your advocacy efforts. Have a record of what went on during the conversation, what the other side said, decisions that were made, agreements that you reached. And then before you end the communication or the conversation with the person, take some time to review your notes and ask for any clarifications if you need. And make sure that your notes are dated so that you can refer back to it later and know when the conversation took place. And then another tip is that if you feel like, writing notes and having a conversation at the same time might be difficult for you, make sure to take a trusted person with you to help you take notes. And if that's not possible, it's also it can be helpful to bring a tape recorder or to record the conversation on your phone, which you can listen to later and take notes on in your own time. But if you choose to do this, it is important to kind of let the other person know in advance that you'll be recording. Okay, so this just has a detailed outline of how to take notes when having a conversation with someone. Let's see. Yeah, I might, just for the sake of time, I might just have you all review this on your own if you're interested, but that's available on the PowerPoint. So some communication basics. So it's important to keep in mind, especially for those of you who plan to advocate using verbal communication. There are 3 different forms of communication, with assertive being the most effective form. And assertive communication is essentially when you stand up for yourself, you openly and honestly express your feelings, you respect other people's thoughts and feelings, you listen to the other person, you make eye contact, you speak clearly, and you show enthusiasm, as opposed to aggressive communication, which is when you talk too loudly or you shout, you stand or sit too close to the person that you're talking to, you clench your fist, you put them down, maybe by using slurs or insults or swearing. You want to win at all costs, even if it's not fair. And then there's also non-aggressive, non-assertive communication, which is just when you don't stand up for yourself and you don't let other people know what it is that you need or want, or you let other people decide what's best for you. Or in other words, you let other people step all over you. And this might look like, looking at the floor and slumping, you might mumble, and just in general, not exude a sense of confidence in your case. Now, of course, practicing assertive communication is something that may be really difficult for some people, especially people with brain injuries, which is valid. And this is where support from caregivers and continued practice and role-playing at home can really be helpful. And then finally, self-reflection is imperative in this process. So this is really thinking about, after you've gone through the whole process, what went well? What didn't go so well? What could you have done differently? Did you achieve the outcomes that you wanted to, and were your needs met? And then also, how did the situation make you feel? Because that's also really important to acknowledge what emotions came up during the process so that you can be aware of them and manage them more effectively. And going through this process can really ensure that you can be even more successful the next time you advocate for the same or similar needs. And then last but not least, it's really important to learn to work with and not in spite of your injury. And while that's easier said than done, try not to look at the brain injury from a glass half empty perspective. It's really important to focus on and build on your strengths. If you have difficulty with verbal communication, but you're good at writing, for example, really hone in on that as a strategy that you can use when you advocate for yourself, and something that you can continue to work on improving. And have a caregiver, friend, or a professional help keep you accountable. But with that being said, it's also really important, and I'll reiterate this from earlier, it's important to be honest with yourself and be realistic about what your limitations are, and working within your personal boundaries and energy level. So as an example, it's really important to prevent overstimulation. When you're having a conversation with someone regarding your needs, don't be afraid to ask to pause or take periodic breaks. And don't be afraid to ask a caregiver or friend to take over the conversation and advocate on your behalf. That is in and of itself a form of self-advocacy and self-care as well. And a couple other tips that I found that I didn't include in the presentation, but it's important that if you are, having a conversation, like for example, at the doctor's office, find a quiet place to rest and regroup. You can find an office with, a kind staff member and ask them for assistance in this. Um, if you have a support person with you and you feel like you need to take a break or you're getting overstimulated, it can also be helpful to maybe hold their arm and look down at the floor to kind of help prevent vestibular overstimulation. And even doing things like wearing amber tinted glasses or ear filters are a good way to prevent auditory or visual overstimulation. And this can be helpful, for example, if you are uh, advocating to legislators and it's like really loud in the courthouse. So while some of these things might seem silly, it can be important to implement them because, like I said, it can prevent overstimulation, which, if you're getting overwhelmed quickly, then that can really disrupt the process of communicating and advocating for yourself. And then finally, giving yourself plenty of time to practice these skills at home with a loved one or a friend by role-playing scenarios, or even just practicing asking for your needs at home, even if it's something as simple as what food you prefer to eat for dinner or what temperature you prefer to keep your house at. Every little form of asking for your needs is an important way of practicing self-advocacy. So in conclusion, self-advocacy is important because it improves outcomes, which means it can really help the survivor and by extension, the caregiver improve their overall well-being. Remember that it's okay to express your needs and to respectfully challenge the other party, even if they are of higher authority, because you as a survivor have the right to make your needs known. And then it's also really important to remember that one size does not fit all when it comes to advocacy. There's no right way of advocating. There's only the way that works best for you, and that's within the scope of your own abilities and comfort level. It's okay to take reasonable and calculated risks when self-advocating because that's a part of self-growth. But it's also important to take your own vulnerabilities and threats to safety into account. And then finally, it's really important that you believe in yourself. For example, by not taking the glass half empty approach to your brain injury and working with it instead of against it, and to have a strong support system working alongside you through the process. And yeah, that's all I had. I did actually want to mention that in this presentation, I went over some kind of big picture ideas regarding self-advocacy as a whole. But one area that I know a lot of survivors and caregivers struggle in is advocating for themselves in the healthcare setting and kind of feeling overwhelmed and invalidated by medical providers, which I think is really important to address and know how to navigate. So I'm actually planning to do a presentation about that at the next caregiver workshop, which I'm not sure what the exact date of that is. I think it's sometime in June. And then I'll also probably pre-record a webinar or do a live webinar on that for anyone that's interested. But more details about that are to come later. But feel free to ask any questions. And I also really encourage anyone, if you feel comfortable doing so, to discuss your own experiences or to share your own tidbits of knowledge on this topic with all of us, because I know that there are probably people here who might have more experience than I do in this area. So yeah, thank you.
Great. Thank you, Tasnia. Is there anybody that has any questions? Currently, there's nothing in the chat. Okay. Well, I think that we can just wrap up this webinar earlier today then.
Yeah, sounds
Great.
good. If anyone has any questions or feedback or anything, feel free to reach out to me. I didn't put my contact information in the presentation, but I could probably send that out. So
Yep.
yeah, thank
And
you everyone for listening. I appreciate it.
yeah, and in the chat is a link to provide feedback for this presentation as well.